Okay, folks, I have 2:35. I'm sorry that we weren't able to get our exhibitor message from our exhibitor, but we'll go ahead and get started with our intensive for today. My name's Tracy Evanson, and I'm a professor in nursing at UND. And I'm also a member of the planning committee for Dakota Conference. So we're so pleased to have you here for this virtual year and anxious to see you all back in person next year. So we have the start of our intensive. So our intensive is actually a 2-hour session. We will take just a little break after the first hour. We have about 10 minutes of breaking. Well, we have an exhibitor message and then a little 5-minute break. So time enough for you to get up and stretch in between the 2 hours and maybe go to the bathroom and get something to drink if you need to. But I have the pleasure of introducing our panel today, who are going to be talking about the impact of COVID-19 on North Dakota healthcare delivery. We are really fortunate to have really a panel of experts with different perspectives, I think, on the impact of COVID-19, and I'm going to introduce them at this time. I also want to be sure and tell you that all of the presenters have indicated that this presentation will not include any discussion of any commercial products or services and will not include any discussion of off-label and or investigational uses of any products or services and will not include trade names. You guys are getting tired of hearing that at this point, right? But we do have to provide those disclosures before every session. On our panel today, I know I don't see, oh, Pete is here. Okay. Pete doesn't have his camera on yet, but Pete Antonson joined Northwood Deaconess Health Center in 1983, initially as the CFO, and he served in that role until 2000 when he became its CEO. Pete has a bachelor's degree in business and a major in accounting and management. And then we have Dr. Andy McLean, who was previously the medical director of the North Dakota Department of Human Services. He's served on a number of clinical, administrative, and regulatory boards, including medical licensing and professional health programs. He's lectured internationally on pertinent behavioral and public health issues. Dr. McLean has a particular interest in working with and advocating for individuals with persistent and serious behavioral health issues. He's also interested in individual and community resilience. Next, we have Matt Shahan. I hope I'm pronouncing that right, Matt. Good. Okay. Matt has been the CEO of West River Health Services in Hettinger, where they operate a 25-bed CA and 5 rural health clinics and a provider-based clinic. He's been there since April of 2016. After working in San Francisco as part of KPMG's risk and advisory practice specialization in IT, security-related audits and operations, Matt began his career in healthcare as the systems administrator at West River in 2009. He would later go on to serve as the director of IT and then the clinical administrator, Glendive Medical Center in Glendive, Montana, where he's also responsible for strategic planning. As part of his role at West River, Matt has operation oversight of 3 corporations consisting of the hospital and clinics, senior living services, and the foundation. Next, we have Renae Moch, and Renae is the director of Bismarck-Burleigh Public Health. In this role, Renae directs the delivery of comprehensive public health programs and services for the city of Bismarck and for Burleigh County. Renae has worked in healthcare administration for both the public and private sector for nearly 20 years. Renae is certified in medical practice management and is a fellow of the American College of Medical Practice Executives, which is the highest level of distinction in the medical practice management profession. She earned a Bachelor of Science degree in Business Administration with a minor in Business Communication and an MBA in Healthcare from the University of Marion, Bismarck. Next, we have Heather Strandell. Heather is the Director of Primary Care Operations, and she oversees 20 primary care clinics in Northeast North Dakota and Northwest Minnesota. Heather has been serving as Altru's health system incident commander, facilitating and supporting efforts to manage COVID-19 pandemic. She received her Bachelor of Accountancy degree at UND in 1993, and prior to joining Altru Health System in 2004, Heather was the Executive Director of the North Region Health Alliance, which is a regional collaboration of healthcare systems in northwestern Minnesota and northeastern North Dakota. Prior to that, she served in other healthcare positions as the Director of Blue Care Network Consultant for Blue Cross Blue Shield of North Dakota, and Network Finance Coordinator for Lutheran Health Systems. So we have really a great panel of 5 experts from various locations around our state and with various perspectives. And I'm really anxious to hear what they have to say about the impact of COVID-19 on our healthcare delivery systems here in North Dakota. I will be putting up the pretest if you have not taken it. I'll put it up in the chat box. If you have any questions, be sure to put them in the chat and we will cover them as time allows. And at this point, I'm going to go ahead and turn it over to our panel.
Well, I'm up in the top corner, and alphabetically, I think I'm first in the alphabet, my last name. So I'll start. Thanks for the introduction. I think she failed to mention that Andy and I are fraternity brothers and past roommates from a long, long time ago. So glad to be on the panel with you, Andy. So
I paid her not to mention that.
there, I blew your cover. I'm going to spend time, though we're a hospital, we have rural health clinics, we have long-term care, assisted living, and independent living at Northwood Deaconess. Because of the other people on the panel, I think I'm going to spend my time talking about maybe more the long-term care, the assisted living, the housing side of the business. I think other people have those areas covered as well. So I think maybe I'll just start with some of the challenges, and then as the panel moves along, maybe I'll mention some of our opportunities that I felt maybe worked in our favor. So one of the big challenges throughout the pandemic is, as a nursing home that's probably got the highest and the most strict regulations and restrictions on visitation and all of the things that are related to COVID and keeping residents safe. And with many parts of the organization not being a nursing home, that always created some challenges. Is when some parts might have been ready to move a little faster, how do you do that with your restrictions of your nursing home being in place? And we do have off-site clinics, but otherwise everything's on one campus. So you've got a conjoined business operation, and so how do you move when you really kind of found out you move only as fast as your slowly moving part? And that's our nursing home. Big building physically in terms of its structure, lots of entrances, not really built conducive to in any form or function to being an efficient use or efficient entry and exit during COVID. Parking lots around the building and things like that. We went to restricted access, of course, with screening. So we have parking lots on different sides of the building that are basically unused, and so creating a lot of congestion in one lot. We did find out that apparently walking an extra 50 steps might kill employees because they wouldn't park in another parking lot. They'd rather park on the street or cram themselves into our largest parking lot, but did create some issues as well. So it's funny though, this is a pandemic, a medical pandemic. We found issues with congestion. Multiple entries also created inefficiencies during really the height of when we were all kind of clamped down and shutting down, having so many entry points for our facility. Yeah, they were reduced, but then we have a therapy department in one area that sees a lot of patients and a clinic that sees a lot of patients, and having to have multiple receptionists when there wasn't a lot of traffic going in and out of the building, but there was still some. So created some inefficiencies as well because of that. Communication, of course, was a big challenge as well. The guidelines changed rapidly. I use the analogy, it was kind of like taking a drink out of a fire hose maybe for the first 4 to 6 weeks. So it was really a challenge. And then being involved in so many different entities, everybody had meetings. So you felt like you had to be at the hospital meeting that the Hospital Association was hosting, Long-Term Care Association was hosting, Grand Forks County was hosting, Altru would host some, just a whole lot of meetings, sometimes repetitive information, but you didn't dare miss because there might be something new and unique from that one. So you spent a lot of time sitting in virtual meetings. So probably one of the other significant challenges as things kind of evolve, when you went out in the community, sometimes you got the impression that they thought you were all contaminated. And I tried to tell people, look, I said, as a nursing home at that time, we were testing twice a week. I said, we're probably the safest. We're like Disneyland, man. We're like the safest place in the world. And you all are going about your day and you don't know whether or not you're positive. So that was just an impression. But I kind of felt that. I mean, certainly I can't talk about long-term care without talking about the isolation that COVID has created. That even now, it just seems like the overarching guidance is always on safety. You know, God forbid somebody's going to die from COVID, but let's kill them from isolation and depression and sadness. You know, they've missed birthdays and holidays and Christmases and Thanksgivings, and they've missed a lot. And, you know, when you enter the nursing home, face it, you know, you probably got more years behind you than you got in front of you. That next Christmas, that next birthday might be your last. So that was certainly a struggle that we saw in the facility. Marketing of any line of business was difficult. You know, coming to admit mom or dad or grandma or grandpa to the nursing home, maybe you'll see here in 6 weeks, maybe it'll be 6 months. We don't really know. We can't tell you when this is going to evolve. Even assisted living and independent living, there was struggles with trying to market those, get people to come in to those facilities. So occupancies at our place, occupancies across the state and all those areas are down. And then probably the last thing is that, you know, pandemics, I don't think are political, but I think we in this country made this pandemic political, and it's divided us a little bit more. I think even within the community, it's created some rifts among those that want to get the vaccine, those that don't, those that never want to wear a mask versus those that always feel you should be wearing a mask. And it's really divided. It's divided churches, it's divided families, it's divided communities. We feel like as a facility, we're the only one that's been really united on pulling the rope in the same direction. I'm pleased to say we're about 80% vaccinated overall for our facility, and our residents are 100% vaccinated. So I'm going to take a break. That was some of the challenges that we saw in Northwood in our system, and look forward to hearing from the others.
Are we going in alphabetical order? Would you like to go next?
Whoever would like to go, but we can certainly do alphabetical. So I think that would be Andy, correct?
Certainly, I can go ahead, and always a pleasure to see Pete, and I know Renae from numerous calls and familiar faces. So appreciate the opportunity. Another piece of my background is I actually am an intermittent surveyor for the Joint Commission for psychiatric facilities, and so that adds another dimension. So I do collaborative care, which essentially psychiatry has been set up to do telehealth for a long time, and so I'm able to beam in. Before the pandemic, I was able to beam into other clinics and assist them with mental health issues. What I noticed from communicating with my colleagues, not only locally but around the country, as Pete had mentioned, initially it was really tough to get bearings, and healthcare organizations and individual practitioners were trying to figure out, okay, do we shut down everything? You know, how do we see people? Doing it by phone, what's the reimbursement going to be? And as things started to settle, there were still some discrepancies among the practitioners saying, well, you know, I'd really prefer, and my patients prefer to continue to do this virtually, and they would get pressure from the healthcare organization. Well, the reimbursement's not as good, and we should bring them in. And so it took quite some time to actually settle on, you know, what the hybrid was actually going to be, and it did continue to be a hybrid. So that was one issue. I think, Pete, you really touched on an important issue, and I think Heather will probably speak to this as well, because being an incident command, we know that in disasters, risk communication is so important. And unfortunately, Pete, as you said, this became politicized, and not only were things moving very quickly, but it was disjointed. We were hearing different things from different people, different experts. And I think that's unfortunately continued as we've moved forward. Because again, one of the things that really is protective for people's mental health, and I'm a psychiatrist, so I go from that standpoint, is, you know, what are the rules? And people can understand and tolerate a lot if they know what the rules are. But the rules, you know, were never really agreed upon by everybody. And so I think that's really been a struggle for a lot of people. The providers, you know, I think it depended on the healthcare organization and how impacted they were. And it was varying in different parts of the region, certainly, and different parts of the state. And I think the response by leadership also had a significant impact on staff. There were some facilities that were being very transparent and calling it like it was. And there were others, when Pete, you're talking about marketing, you know, others were not being as forthcoming. And I think that mixed message was difficult for providers and for staff. And, you know, one of the things that was occurring, and I was communicating with my colleagues out in New York State when they were just getting pummeled, is the concept of moral injury that providers experience. And that's really when you know you're supposed to provide a certain type of care, but you're unable to because of resources or policies or whatever. And so for providers, I think that continued to be a significant issue. Fortunately, I think in North Dakota, the Department of Health worked with the local healthcare organizations to try to make sure that they had the resources that they needed. I think in North Dakota, we were probably a little more fortunate than a lot of places, but still, as I think Renae will attest to on our physician advisory group calls, it was still stressful, but it came in waves. And one of the things that I thought was so impressive in listening to people, not only throughout the pandemic, but actually just today in some of our table discussions, was how supportive organizations could be for their employees. And the ones that were most flexible, the ones that were looking out for each other, you know, they've come through this, I think, much better. And it also obviously depends on how many losses you had. That certainly adds up. You know, I shared with some others that when we look at organizations and resilient communities, you know, there are a number of traits that are identified, and one of them is strong leadership and the ability of leadership to engage their staff and their citizens. So Pete, when you talk about you had an 80% vaccination rate so far, that's incredible. You know, that's absolutely wonderful. You know, another trait is, you know, the wise use of resources and the ability to get the resources that you need. And then lastly is, you know, having a finger on the pulse of how things are going with your staff in terms of psychosocial sorts of issues and being attentive to that. So, you know, what I'm hearing is the ones that have had that ability, that flexibility, that two-way communication, you know, watching out for each other, have certainly come through this, you know, best. We're certainly not out of the woods. When we look at mental health issues and the impact that COVID has had, you know, certainly it's been more of a struggle for youth. It's actually been a bit more of a struggle for moms, for women. When you look at surveys, the least impacted, you know, Pete, even though the individuals in the nursing home clearly are impacted, but the individuals living at home who are over 65 tend to be less impacted than those that are teenagers or 18 and to 35. Substance use has certainly gone up significantly, overdoses. Suicidality, thoughts about that has gone up, but actual suicide rates in the general population haven't, as of yet. We're not out of the woods, but what we've seen is, being isolated or doing everything virtually, there's less ability to check in. There's less ability for school nurses to curbside with a student and check in. And so what they've found is that when there are presentations by people with mental health issues, they're actually, they're in deeper, they're in more trouble. And so, that's one of the things that we've seen. What remains to be seen, certainly, and some of you will talk about it, is what are things going to look like in terms of care, these hybrids that we're talking about, what's going to be reimbursable, what's the public going to demand as we move through this. So that's my spiel. I only see first name. Well, I see a couple of other last names, but I don't know who goes next. So I'm guessing probably Renae.
I think Renae would be next alphabetically.
Perfect. Thank you. I can certainly go next. I do have a couple of slides just to walk us through a few different things. They're real short, so I'm going to try sharing those here with you, following the instructions.
Renae.
Renae, we're able to see your I don't know if you were talking, but we weren't able to hear you.
I think it went back to muting me there. I can just talk through some of the bullet points that I have. I do have one visual that I'd like to share, hopefully, and I can get to that in just a bit. But if you talk about public health and what we experienced throughout the pandemic and the impacts that we had as public health professionals, we were really launched to the forefront of this global emergency during this time. And public health is usually operating behind the scenes on a normal day, bringing you clean water, smoke-free environments, and those types of things, and usually don't get a lot of complaints unless something goes wrong. So it was really a new thing for us to be launched to the forefront, leading an emergency, a public health emergency. We had been through several exercises in the past, pandemic influenza planning and all of that in the past. But this was a real emergency, and it was real kind of frightening actually to begin with in the beginning, when there were so many unknowns about the virus itself and who could be impacted, how it was spread, how the staff were going to be able to work through this. Would my staff become ill? Would they be passing it between each other? Are we able to help the public? All of these things were going through our heads. And in addition to that, we were looking at our normal operations and what we had to do on a daily basis to try to incorporate those types of things, because we couldn't completely stop our services. We had people that we go to see in homes. We have home health services where medication is set up and different assessments are done, and we couldn't completely cut all of that off. And so really had to streamline and look at what we were doing in our clinic to see what we could do to try to accommodate all of those different things in addition to COVID response efforts. I know initially we started with contact tracing, and public education was huge, and then moved through different phases of the pandemic. And I have a slide that is, and if I can't show it now, I can show it at the end possibly, but it shows about how we moved through the phases of the pandemic, from preparing for disruption, like what was going to happen, what do we need to do to prepare, actual disruptions to our operations, and then peak infection and crisis management. And then we de-escalate, and that was probably in December, January. We were starting to come off of that peak crisis mode. And now that vaccinations are available and people are getting vaccinated, we're trying to establish and go back to a new normal. And through all of that, I think there were some highs and lows, that, as Dr. McLean had stated, with the staff and with the public. Initially, when we had put forth our messages, people listened, they were masking when we were advising them to, staying home, washing hands, doing the disinfection and that kind of thing. And then we started to get into the pandemic where things reopened and we weren't really hit as hard as some of the other areas in the nation. And I think at that point it was the tides were turning a little bit, and that would have been after the 4th of July here for us in Burleigh County, where we had some gatherings and such over the 4th of July holiday. And then we started to see an uptick in cases, and increases went up through August, with cases increasing, people going back to school, people going back to college. We had a task force that was formed for Burleigh and Morton counties because we were the highest rates in the area. And that was a very stressful time for me and for our staff that were working in this environment. I know that if you didn't know Renae Moch before the pandemic, you probably know her now. It was a challenging time for me. I think I was valuable. I have a valuable employer. They were supportive of me to be able to speak the truth on what was happening, to provide the education as needed, the information we were getting from the CDC and all the other areas. When we look at, some of the different entities, we had employees that were seeing, frontline experienced workers, seeing the tragedies that were happening firsthand as caretakers, but weren't not necessarily able to speak on the severity of what was happening in our local hospitals because of that. They weren't a representation for the employer, let's say. And so that was a bit challenging because it was me hearing those stories from the friends and families, the physicians, the nurses, the emergency room workers, all those types of individuals were sharing stories with us. I had information on the weekly calls that we were doing with our groups that we were involved in. And for me to bring that information to the public to say, hey, we really need to do something, what we're doing is not working, was definitely a challenge. And that brought a lot of attention. Much of it was unwarranted, I think, but we were able to work through that and saw our peak in November in Burleigh County, November 13th. That was the highest number of cases that we had. And that was also the day that our governor announced the mask mandate, statewide mask mandate. And so that really changed a lot of things for us in public health. We finally saw some reprieve in the hospitals, and their response, I think, followed shortly after that. So we were grateful to get the vaccine, and kind of went through, the ebbs and flows of the whole process. When we had the vaccine available, that became another stressful time because people wanted the vaccine right away, didn't want to wait, and were really trying to plead their case with us as far as why they should be getting vaccinated versus someone else. And we were trying to follow these rules to make an equitable decision. So we've really come full circle. Happy to be in the place that we are now over the last year and a half. But that's our story on the side of public health.
All right. It would be me. So before I forget, the first thing I guess I would bring up is to say thank you to not just the panelists or the Center for Rural Health, but everybody participating in this conference, because you're here because you have some role in healthcare, and regardless of what that role was in the last 16 months, it was incredibly important. And I don't think as a country we will ever truly understand just how important everybody was during this process, because without everybody involved, I think we're in a much different situation still today than we are. So thank you, everybody, for all of your efforts. I do really wish we would have had a historian in place at my facility, even, you know, starting back. My memory is bad as it is, but, you know, I go back to, it was either, you know, March 13th or March 16th, 2020. You know, Governor Burgum called a press conference on a Sunday evening, and we, you know, text message flurries went out, and administrative team members and physicians came here to the boardroom, and we sat down and we watched it together, and we talked afterwards about, you know, what was going to change going forward, what things we needed to do. And I hope everybody else had the same experience. You know, you quickly realized that all of the preparation, all of the, you know, emergency meetings leading up to this, we still weren't prepared, you know, and the planning that needs to go into this continuing going forward is an eye-opener. I'm fairly young in my career, and I hope we never deal with anything like this again. But I hope we come out of this with some guidelines and a roadmap for those who will follow us into the future. Our facility, you know, we're very, very lucky that, you know, we had things like negative pressure rooms in the hospital. You know, we've got a fairly robust, you know, emergency preparedness program. We've got great infection control, quality, and we're extremely lucky to have the number of providers that we have. Whether it's internal medicine, family practice, you just go down the line. We're extremely fortunate. You know, we, like everybody else in the state, I think we locked down quick, and our community locked down really quick. Everybody took this thing serious. You know, you look back at that, and it's actually incredibly impressive how well North Dakota residents stepped up right away and just did the right things. I've said it before, and I'll say it into the future. Hindsight's 2020. That's a terrible saying when we're talking about the year 2020. But you know, when you look back on it, it's, yeah, we did things too quickly at times, and I think that's what led to a lot of the public perception that we've fought against since then. But looking back on it, personally, as the leader of this organization, I wouldn't change how quickly we did things, because I can look back and say we locked things down too quickly, and we were, you know, too restrictive, but it didn't hurt anybody right then. And had we not done those things, and we had residents pass away in our nursing home or our hospital, or an outbreak in the community, you know, that's something I personally would have had to have lived with for a long time, and would not want that following me. We, you know, we saw our first COVID patient in August. And actually, we got a call. I got a call personally from a neighboring CEO, and he informed me that there was 3 nursing home residents coming in the same ambulance, and that they would be here in a couple hours. 45 minutes later, the ambulance called our nurses station and said they'd be there in 10 minutes. They were at the junction, and they would be in town in 10 minutes. It was 90-some degrees that day. The ambulance crew was very understanding. So were the nursing home residents. You know, we had to finalize our COVID wing hall. So they actually sat in the ambulance for about an hour out in the parking lot. From there, you know, we saw that slow uptick. It really followed the lines that Renae talked about, you know, that August and September. October through early December is something I hope my staff is never subjected to ever again. When we are, you know, some of you may have read it. You know, I was quoted in talking about having to call another hospital CEO and beg them to take a patient. We were bursting at our absolute seams. Our staff was overrun. They were tired. You know, they're in these rural areas. They're not caring for a stranger coming in off the street. They're caring for somebody that, you know, they've known their entire lives, or, you know, are their parents' best friends. And, you know, while we had a very low fatality rate of our COVID inpatients, just the struggle of seeing someone you know and you love was something that you know, as Dr. McLean mentioned, the moral injury and the ongoing impacts, I don't believe we truly have an understanding of, and it's going to take a while for us to to fully realize that. You know, coming out of the pandemic, staffing is starting to come back around, but we had retirements because of it. We had people leave because they couldn't afford to go home and potentially take something home to a loved one that was compromised. So that was a struggle. We're still kind of struggling with staffing across the country, traveling, nursing. That whole world right now is making it extremely difficult to staff facilities. My biggest concern is, I guess I'll kind of wrap up here and then we can get to some questions, or actually we'll get to Heather here in a minute. But it's been mentioned, but I don't think we can talk about it enough. And it's the ongoing impact of the mental health of our healthcare workers. I didn't have to work the ER. I didn't have to work on the floor. I didn't have to work in the clinic and wonder about those things. But I think I would be lying, and I think we're all lying, if we look at the last 14 to 16 months and say that it did not have some sort of negative impact on our mental health. The concerns for your family members, the concerns for your communities, the lack of having a conference in person where Pete and I can have a beer after something like this together. The lack of just meetings and being a part of each other's lives in person, or feeling not as disconnected. We've got an uphill battle, and in a state and a country where mental health was already an extreme concern. We are now coming out of this where we've only amplified the issue. And as healthcare workers, we've got a long ways to go in an uphill battle. But if the last year has shown me anything, that I believe we've got the resolve to meet those challenges. We just need to get together and formulate a plan. So thank you.
Thank you, Matt. I too want to thank all of you. Throughout this pandemic, there's been lots of opportunities to reflect and appreciate not only our internal teams, but also our community partners. And I can't think of a time that I'm fortunate to be a resident of North Dakota, because throughout the last year and a half, we have all probably connected with each other locally and throughout the state to answer some of the questions and concerns that we're all going through. Altru, just reflecting on our emergency management system, as Tracy said, I served as the incident commander and will officially get to hang up that badge tomorrow, because our command center is going to demobilize. We have probably attempted to do that 4 different times, and then we've had a particular situation, if it's the surge we had in October to the vaccine coming in December, but we are feeling that we're in that maintenance and recovery phase of our organization, that we can incorporate all of our safety processes and protocols in normal operations. We followed 4 phases: initial, restart, maintenance, and recovery, and that guided us through the last 15, 16 months. We had challenges and successes at each one of those phases. Our initial phase officially kicked off January 22nd. Our emergency manager, Rick Litzinger, is absolutely wonderful, and he brought a group of people together, just situational awareness of what was going on even outside the United States at that time, in anticipation of, if it reached us, what would we need to do. So our first official planning meeting was in February, just to identify what should we communicate to the organization so they can hear it from us first rather than hear it on the news. And that was kind of our philosophy too. We were very transparent as an organization. We wanted to communicate as much as possible internally, which also was a challenge because it created some trust issues. Our staff relied heavily on our command center messages that went out daily, but as has been mentioned here, it changed. You know, a health alert would come out in the morning. We would communicate something to our staff, and then something would change that afternoon. And our team was starting to question the credibility of the command center, thinking we were just in our command center office making changes at whim, but that wasn't the case. One of our other challenges was navigating multiple states. So we have clinics in Northwest Minnesota. So we were monitoring not only North Dakota, but also Minnesota. And both states had considerable differences in how things were being managed, in particular when we got to our recovery phase and the vaccine too. So navigating both Department of Health and public health agencies and all of those communities kept us on our toes, but we appreciate all of their guidance. And then in the middle of this pandemic, we had operational performance issues. So our organization was faced with 3 pretty impactful decisions. One was to pause the construction of our new hospital. The second was we asked all of our leaders to take a pay cut to assist with our financial challenges. So supervisors on up, including physician leaders, had a reduction in pay, and we asked our staff to take PTO, or we had system reduced hours. And then the third was on June 1st, which was another monumental day in our organization when we had a reduction in force. So very difficult decisions as we were navigating how we continue to keep our community safe, our patients safe, and our employees safe. Some other challenges that we faced was just with monitoring our supplies. When you think back to in our command center on a whiteboard, we kept track of how many masks, how many N95s we had, how many test kits, and we would review that hourly. And now we have enough masks that we don't have to reuse, and we even order masks to align with the holidays and have some fun with things. But we've navigated through those supplies and are feeling better about where we're at. Other difficult decisions was just service decisions. When we decided to no longer offer elective surgeries to help with the PPE, reaching our patients differently, going to a virtual model. We conducted home visits. We did COVID swabs in some individuals' homes, and assisted living facility and nursing home facilities, just to minimize the fear and the risk that we were feeling from not only our community members, but also our staff too. Just the fear of the unknown. And we continue to have a little bit with that now too, with the vaccine. So we've been through a lot, but we also have had some really great successes, and have been able to move some services and some different healthcare models that maybe we had resistance before, and have had great success now too. We were very quick in all of our processes to respond to the pandemic. Our command center officially opened on March 10th, and within 2 days we had our COVID hotline and our curbside testing functional for our community. Our COVID hotline was able to manage almost 100,000 calls since it was launched on March 12th. And just to give you an example of the reach we had a gentleman from California get connected with our hotline here in Grand Forks because they weren't getting that same support with the community that they resided in. So just to know that our processes were able to reach other people outside of North Dakota was a success. So those of you that went before me touched on a lot of the same challenges that we had. As incident commander, not only did we manage the pandemic, but we also had our operational performance to balance at the same time, which was complex and challenging, but we're in a better spot because of it now. Thank you.
Thank you to each of you to talking about some of those challenges. We do have a couple of comments in the chat box. So Debbie Swanson is asking if Dr. McLean could comment on moral injury in public health professionals. Is it studied? And she gives an example. We had to stop contact tracing in November, knowing that we would not be able to slow the transmission effectively. This seems to fit with the definition of moral injury that you provided, but on a population scale.
Thanks, Debbie, for the question. I can't recall if you were on the Physicians Advisory Group presentation when I presented on essentially resilience, including specifically public health, because that was my worry. I think most of the data, most of the studies have been on regarding direct healthcare workers as far as moral injury and health. There's probably some studies, but I'm not aware of any right offhand on public health officials or providers. So if you want to work on a paper, I'm game. The concept of moral injury originally came about from the military, when people were, not only witnessing but perhaps perpetrating, actions that were against their deeply held moral beliefs, and then that dovetailed into this whole concept of, not doing what you know is best and know is right, because oftentimes either administration doesn't allow it, or you don't have the resources to do it, and then that causes significant moral distress. So back to your question, there is no doubt that you in public health were experiencing that, based on what you were discussing, that you weren't able to do what you knew you should be doing and would be helpful for people. But in terms of studies, not so sure. So again, if you want to take the lead, I'd be happy to help you out on that. And Renae is probably a study case for what she experienced over the years. She's become an international star.
There are some things that went well, and we talked probably a little bit of gloom and doom, and there were some lessons learned and some of those things that I wanted to share. So I wrote down some challenges early and addressed those. And so what worked well, or what were good opportunities that seemed to work well for us? I guess one of the things we did early on is we had every staff person fill out basically a skills inventory. So if you needed to be repurposed, what could you do within your licensure? I could cook. It's because I'm the cook at home. Wouldn't be much different than the Norwegian fare that they get here all the time, but I could do that. And everybody did that. Well, that got to be a real benefit when COVID hit the fan at Northwood Deaconess and we had to open up a separate skilled unit. We had to repurpose a lot of people. Being a combined facility, we did have some resources. We pulled over clinic nurses, we pulled over aides from rehab, we pulled over therapists, and they helped wherever they could. Sometimes it was as simple as making beds. Sometimes the rehab aides were then, our activities people were moved into certified nurses positions. So because they were licensed and able to do that. Other things, we have an engaged medical staff, which is awesome. They were involved at the whole time. Nice to have those people at your facility. Standalone nursing homes probably didn't have that opportunity. So that was certainly work. The culture of our management team, that's developed over time, and they're not afraid to swim against the tide. And I think I've always tried to listen to all opinions. And I think that everybody felt like they could speak up and say their part and engage in conversation. And that's a real benefit. I don't necessarily recommend it, but the tornado of 2007 really gave us an opportunity to learn crisis management. We developed some communication tools, daily briefs, we call the daily briefs, information that we put out every day. Some of those things helped, and people were used to those methods of communication. Having some things like a Facebook presence and a website and things like that. There was a lot of notifications that can't wait for the weekly paper from Northwood to be published. You had to be getting that stuff out immediately. So having a Facebook presence, social media, those types of things were definitely an advantage for us, helped us with communication, helped us get the information. And then sometimes, you know, you're kind of just lucky. And we're fortunate enough, we have a member of our medical staff that's on the school board, and asked us to, the school ended up asking us if we would provide a school nurse. And if you're familiar with the emoji on your phone, that's the big bug eyes, right? That's the first reaction I got. And of course, the second one was, let's look into it. And, you know, speaking of lucky, I think we woke up on third base and thought we hit a triple. We were able to hire Brittany Ness, and she's done an awesome job at the school. And we felt like, for a lot of reasons, we needed to do that. If the school can stay open and healthy, it supports our workforce, it supports our community, it's a large employer. I mean, it just seemed to make, how is this community going to manage COVID? If we can manage our workforce at the school, if we can manage to keep that school open, we'll have parents that are going to be able to come to work and keep that workforce going. So Brittany did an excellent job, and it's given us opportunities going forward. She's going to be part-time in that role and part-time for us going forward. So it did open some doors for us. And again, it was probably just because we were lucky in that case. So just some of the things that went well. So it wasn't all gloom and doom, and some things are going to be good going forward.
Yeah, Pete, I guess I'd piggyback on what the positive things that we did see come out of this, and it's collaboration. You know, in the midst of this pandemic, it didn't matter to anybody, you know, whose logo was on the outside of your building, whether it was public health, whether it was Altru, Sanford, CHI, you know, any of us independents. You know, we actually held we had a meeting of there was 4 or 5 of our rural CEOs and one of the larger health systems to discuss, you know, exact things. And it was, how can we take your lower acuity patients off your hands so that you have room to take our COVID patients? You know, how do we work together as critical access hospitals to, you know, funnel things to the right areas? Whereas in the past, you know, we're competitive because we all have margins we need to hit. But throughout this pandemic, I think that's one of the best things is borders and allegiances and everything went out the window. You know, everybody just looked at it and truly said, you know, are the decisions and the actions we're taking in the best interest of our patients and our communities? That's something we really, I guess I really try to look at is, you know, if we're not doing those things and it's not our priority, we're in the wrong business. And this pandemic gave us that opportunity to really, really work together just as a healthcare community rather than, you know, West River Health Services.
I would agree with both Matt and Pete too. We talk often at Altru that our image changed for the positive within our communities in the state because of the collaboration, especially across the river. We partnered quite a bit with the Minnesota public health agencies because they didn't have the guidance that our Grand Forks public health had because of their leadership in the state. Even with our school district, we too are are having conversations about school nurses and how we can partner differently going forward based on the pandemic. I remember when, so my husband happens to be a high school principal, so I had the inside scoop that they were thinking of going to virtual learning when we were experiencing the surge, when we were already challenged with staff and redeploying our resources from our clinics or therapy departments to the hospital. And we were able to have a very quick meeting with our superintendent to see how we could expand after school and daycare programs. And we had a community foundation set up for financial resources, so we're able to help some of our employees that their kids could go to these options so they could continue working. But it's just been very gratifying to be able to work with agencies, and I especially like what you said, Matt. It doesn't matter whose logo is out there, it's just everybody coming together. Our most recent example, and I know Debbie is participating in this breakout, is our partnership with public health here in Grand Forks to vaccinate at the Alaris Center. It was pretty humbling to see just how many people were so grateful to be able to have that option and be able to vaccinate so many people so quickly because of the community partnership.
About 4 minutes left of this first hour, and we can certainly come back and include some more questions. I know there's more questions in the comment box, but and just in the last 4 minutes that we have, I wonder, Renae or Andy, would you have anything else to add about, kind of the positive or the, things that went well, as Pete said?
Well, I think I can add, yeah, a lot of individuals found, particularly with their family members, that they got into more of a routine in terms of contacting them, and actually routines are really important in terms of resilience and mental health. Hobbies, doing things that they'd always put off and that they were kind of forced into looking at again, I think was very useful. And so I think, as Pete also mentioned, and I think Heather and others, there were some people that reached a point where they just said, I need to look in a different direction. This isn't for me. They may have been, thinking about it, and they were able to make that decision and move. And even though that was a loss for the organization, for the individuals, that was sometimes a good move. I just wanted to dovetail and give Renae a chance here too. But when Matt was talking about, borders, those were eliminated, and Heather was also adding that. These were opportunities, I think, for organizations to look at their mission and vision. I always just used to think that was fluff, but if it's meaningful, if you really put effort into it, when things are chaotic, you can move back and look at your mission and vision, and if it's done well, that really can help to continue to guide you in the chaos. So, Renae?
Thank you, Dr. McLean. I think the biggest thing we've really seen is the growth of closeness between the public health team. We've really pulled together to take on all this additional work. The staff really put in long, hard hours, long days, and we're willing to do it, do whatever it takes in order to get the work accomplished and the work done. And that really brought a lot of people closer together and developed some friendships. I think that was the positive thing that came through that. For me, I think it made me a better leader, a stronger leader, trying to think through all of the different angles that people were looking at me from a political angle, from a public health director, from the NDPHA president, trying to fill all these different roles and do justice to each of them made me a stronger person, I think, to be able to try to fit the profile between them all.
And it's moved our healthcare system forward much quicker than it would have. As we look at virtual care, it went warp speed. And so it's going to be interesting to see what transpires after the pandemic.
So welcome back to the second hour of our intensive. So I think, Renae, you had something you were going to try and share. Do you want to go ahead and do that? And we'll see if we can get it to work.
So I'm not going to put it in presentation mode, but I'm going to try this to see if you can see my screen. This is the slide that I wanted to show. Are we getting started, or do you want me to hold off?
So just in coming back, there's been some comments put. I don't know if everybody's had a chance to read them, but there were several comments put over in the chat box that several people noted that one of the positive things to come out of the pandemic was in relation to getting school nurses into schools that did not have them before. And how the role of that school nurse became so important. And hopefully we can get some sustainability around that. So I think, that's certainly a policy issue going forward that, we need to think about as healthcare providers in the state of North Dakota. There was a question also specifically for Renae, and let me see if I can find it now. Renae, Dan Kelly asks, he said, given the benefit of hindsight, would you do anything different in the attempt to reduce the public pushback?
I think the biggest focus for me, came from the task force, the launch of our task force for Burleigh and Morton County. When that task force was formed, it was public. So all of our meetings were public meetings. And when you're trying to plan a pandemic response, and you're a public health entity and you're working with other healthcare facilities and you're trying to work through challenges, having everybody's eyes on you from the entire community, so they were live, they were recorded. That was, I think, part of the reason that a lot of attention was focused on the task force itself, and me as leading the meetings and putting out agendas and doing all of that. I became the face of that task force, and unfortunately, the mouthpiece for public health mitigation measures, and then that put me out there as a target, unfortunately. So if we were to do that all over again, I think we could have done that without a formal task force being formed. We could have still worked with the partners in the community to work through all of that, but the formality behind that really made things challenging.
How about for the rest of you? Were there things that you would do differently so that there wasn't as much public pushback from what your perceptions were?
Well, I think it was clear that, information alone didn't do it. The difficulty is, finding out what people's goals are. I think maybe moving backwards in terms of what's relevant to people. It was interesting as the pandemic moved forward, and we learned more about COVID, and also learned as we were trying to engage people with regarding vaccines. I think, Renae, this is maybe in the Physicians Advisory Group meeting, and Debbie, one of the comments was, that 6% of men who get COVID have erectile dysfunction. And so, finding, so in a conversation with somebody, let's talk about these issues. And so that wasn't a minor thing, actually. If there are particular areas that really make people sit up and listen, and may actually move people further down the readiness for change, we need to find those sorts of things. We were discussing, though, that it's so important, rather than listening to public health officials, what people were finding was the most trusted individual, if they were going to listen, was their provider. And so then bringing that message back to them, as opposed to these external experts who may be sharing the same information, but moving it back to a relationship, I think was something that we would probably move towards a little sooner.
Dr. Pete, any other things in terms of public pushback that you would do differently?
Boy, that's a great question. I don't know that I got an answer for it. I just did take note of, I think, something early on that Dr. McLean mentioned, and we have to take time to thank our staff. We have to take time to celebrate. We have to take time to party, or whatever it is that you need to do. And, you know, I was asked a little while ago, what are you going to do when this is over? And I said, I don't know if we'll ever know when it's over. I mean, it's not like they're going to say, well, you know, on July 31st or August or whatever the date is it over? So are we just going to jump into the next thing that we typically do in all of our work? So, you know, there's probably not going to be that line in the sand that says now COVID is over. So I think we have to all remember, if we're leaders in our organizations, to try to do something for our staff and take care of them, because they're the ones that pulled us through this, that pulled our community through. So in terms of your question, I don't have an answer to that. I just wanted to add that comment as probably the last thing that I may have to say today as part of the panel. I sure appreciate the time and effort put in by everybody.
Well,
I would,
oh, go ahead, Heather.
no, I was just going to add too, in regards to the public perception. I think one of the successes we had is that we had a unified message in our communities, because Altru and public health, and to Dr. McLean's comment about our physicians, we had a few of our physicians be the face to the public. They were with our public health officials or our city officials on social media posts or radio stations, talking and educating our community. We are having those conversations now in regards to public pushback, because we are every day now we're getting questions. Why are you requiring me to wear a mask at Altru Health System when I don't have to at the grocery store or Target anymore? So we're still adhering to some of those safety protocols that other industries aren't. I think we're probably getting more pushback now than we did earlier in the pandemic, when everybody was following the same protocols. So we just have been meeting this week to talk about, okay, what's that message to our public? To what Pete said, we're not over. The pandemic's not done. And we don't want to relax too much with our PPE guidelines or our visitor restrictions, because we don't want to be in a situation we were in fourth quarter last year again too.
Thanks.
Yeah, I guess I would just, the thing I would add on to that is, you know, we actually kind of joked at Incident Command a week or two ago that, you know, this time last year we had community members running in the front door of the clinic, stealing boxes of masks and running back out. And this year, same time frame, you know, our poor front desk staff and our greeters are practically having, you know, being accosted about asking somebody to wear a mask. So in one short year, you know, it's changed so much. Looking back, you know, I wish we as an organization would have done more to keep that momentum going from the community, because, you know, April and May last year, we had local businesses showing up outside and barbecuing for our staff, offering free meals. You know, a lot of those things. We had churches showing up and with megaphones praying over the hospital out in the parking lot. A lot of those things that were happening are things that, quite honestly, as a society should just be happening going forward, not because we had a pandemic. And so I think that's one thing I wish we could have done a better job of, was just keeping that healthcare heroes and, you know, communities looking after one another better. And we've kind of failed there. And somewhere along the lines, I can't find the when and the why, but, you know, a lot of our community in our state, unfortunately, has gone back to believing Dr. Google and Dr. Facebook rather than, you know, trained professionals who have dedicated their lives to protecting the public.
Thank you all for that. I want to build on what Pete had mentioned about, you know, doing something to show appreciation to your staff, to kind of recognize the long journey that this has been. And, it was kind of a question on my list to ask you all what kind of strategies you have used, or what are you planning to use to help employees cope with the mental health stress of this pandemic. And so I'd be interested in hearing if you have used any strategies. And from Dr. McLean, what might be good strategies for employers and supervisors to use?
Well, I think a lot of organizations, and actually I had a conversation with some individuals at the conference today, and I'd actually recommended this to the to university as well. Most places where I'd worked before, there were fund groups, there were committees whose job it was specifically to come up with those sorts of staff interactions, or games or prizes, or just making sure they continued to connect people. With the med school, I still don't think that's actually happened, but I know that that's been important for a number of different organizations, and it's been meaningful. Doing it just obviously staff, can see through that, but I think the ones that have sustained that, and it's been, from a volunteer basis with staff, picking up on that, I think has been very successful. So that's one small thing.
We've had several conversations at Altru about this too, because we have definitely seen the burnout, and I appreciate that you mentioned that too, Matt, in regards to the community support. We had so much community support, and now it's kind of weaned. And we're trying to balance what we do for employee engagement with still being good stewards of the community, and being leaders, following the safety protocols and social distancing. And we had very stringent guidelines: no potlucks, no congregating in nurses' stations, because we need to keep everybody safe. So what we did pre-pandemic and have started again is rounding, and having our executive team and leaders out and on the units, in the clinics, checking in with people, one-on-one conversations with individuals. The other challenge that we've been navigating is we have a lot of staff that are working virtually. Our support staff, human resources, IT, finance. So just being creative to pivot how we do connect with them, knowing that we're not catching them in the halls, or we can go to their office and have some conversation. So we're trialing a few things, but I don't think we've gotten a home run yet either, and would be open to hear from other organizations if they've been more successful than we have.
Yeah, this is an ongoing battle, and even probably before COVID, on the right way to retain and reward your staff. And but during COVID, we I think, like a lot of healthcare institutions in the state, we issued retention bonuses based on hours worked, and we did the hours worked specifically because we did have staff who chose to not pick up shifts during this time. And we wanted to reward those ones, even above and beyond our usual incentives and time and a half for working overtime, all of those things. We issued our first one of those, I believe it was in August, and we issued another one the week of Christmas. And then shortly after that, in this spring, it's amazing as something as simple as logo wear, but how staff do actually, they will tell you that they don't like logo wear, and they'll never wear the company logo. But we issued out $75 per staff member in logo wear credit, and people were just, I've gotten more thank yous for the logo wear than I think any other thing we've done in my 5+ years here. The rounding is an incredible. It's just an incredible tool as a leader, and one I don't think I truly realized until this pandemic. my wife's a nurse, so I feel fairly comfortable in saying this, but the nurses usually don't care to see the CEO out on the floor. They're like, what are you spying on us, or what's going on here? We recently had a changeover in our CNO role, and so I've been spending a lot more time out on the floor. And when I announced that we had an interim CNO chosen, the immediate comment from a couple of the nurses on the floor was, will you please continue to come out and check on us every day like you have been? And so that, I think, clearly it meant a lot to them as staff, but gosh, that means a lot to you as a leader, when they want you to be a part of their daily operations. And so, it was tough during the pandemic when you're telling people not to gather, but then as a leader, then you're going and walking through departments and asking people. But at the same time, I think it was appreciated when we were able to do it. And quite honestly, I don't know if we can ever do enough of it as leaders, just to be present.
That's a great example, Matt. Renae, how about you?
I think as a government entity, it's a little bit more challenging for us to do some of those perks because we have limited funds available, or they can't be used for promotional types of things. But I think a great reward for us was when we started our mass vaccination clinics. The reception that we got from people coming through receiving that vaccine, people were overjoyed. They were gracious. Some people hadn't seen their family in a year. And just being able to provide that vaccine to those individuals, that was a very uplifting experience for our staff to participate in that after having been through the challenges all the way through up to that point. And I think a lot of us really enjoyed that interaction with people and being able to really understand how much it meant to them to be able to provide a vaccine for them. So I could think about that.
Well, I'm going to ask a question that is somewhat similar but different to what we've just talked about. And I can't take credit for this entirely. I actually have a PhD student that I'm working with, and she, in light of COVID, has shifted her dissertation topic. And she is wanting to study among nurses, but I think it is relevant to any healthcare providers during the pandemic. And she wants to study what has given them hope during the COVID pandemic. And which is really kind of a different take, I think, of what we have. When she presented that to me, I had to stop and think about that because we haven't so much focused on hope in the pandemic. So I'm going to steal from her idea, and I'm going to ask each of you, what has given you hope in the course of this pandemic?
Well, the easy, obvious one, the vaccine. That felt like hope when you started getting vaccines in arms, and it almost immediately it seemed like, at least in our part of the state, that the numbers were going down already, and that just created some momentum. So vaccine, that's one thing.
I think the response in this among the healthcare providers and the healthcare organizations, I think that was very hopeful. It's that's countered by the frustration that I think people felt when they were busting their butt and other people weren't willing to go along with the public health recommendations. I think that was certainly very frustrating and continues to be frustrating. But I think the way that providers rallied for each other and were supportive of each other and are supportive of each other, that's certainly hopeful.
For me, I think for public health, we saw some real rough times, but one of the big things that brought me hope, I think, is when the people in the community, actually from across the entire nation, when we were at our worst pandemic outbreak in North Dakota, and that was on the national news, received letters of support, encouragement, cards, emails, all that type of thing. I mean, really having that at such a difficult time provided me a lot of hope that there are some people out there that support what we're doing and understand the challenges and really didn't have to do what they did. I mean, they sent, we got some masks, homemade masks made for us that were sent from out of state, got some surgical caps sent to us from people that don't know us, just real nice things like that, that really provided some hope for all of us as we were working through that really tough time.
Yeah, I actually, Renae, that was exactly what I was going to use. We had a 4th grade class out of the New York area send us a letter, and all the kids had signed it, and they talked about how they had watched. I unfortunately, and I do say unfortunately, was on the Morning Joe show, and I say unfortunately just because of the circumstances, not because of politics. You know, and they saw that, and those kids, they wanted to reach out and just say that they were thinking about our community and our staff and all of those things. From a community-wise perspective, you know, there was a really cool time in late April and May when businesses were shutting down and things were getting really grim. And we had some good community members step up, and one of the restaurants here in town, she had more free meals for the elderly already paid for than she could actually hand out over almost a month period. You know, if you were over 65, you could call down to the pastime and order whatever you wanted off the menu, and it was already paid for. You know, our grocery store went to delivering meals instead of having people come in. There was so many things from the humanity part of it that, you know, you looked at it and said, this thing is bad, but it's really bringing out the good in a lot of people.
And I would agree with what all the other panel participants said, especially with Pete. The vaccine definitely gave me hope, starting with our employees and then our public, just the onset of people that wanted to get it as soon as possible. And then just our team, our organization. We had so many people step up and just go above and beyond, like other facilities and agencies, and they continue to do it. We asked a lot of them, and we, as I mentioned earlier, had a lot of very difficult decisions to make as an organization. And for the most part, our team stuck with us, and we're in a better spot today operationally, and it's because of just that commitment and dedication that they have to the organization and the community.
Those are some great examples of what would inspire hope. How about from our audience? Any other questions? Karen Aaron's comments that all of you give her hope. I do have another question for you all, and I'll wait and see if we get any that come in from our audience while you all are answering this one. But I know you all have touched on this some in different ways, but what are some of the lessons that you think you have learned that could inform any other future pandemics? I mean, we've kind of touched on some of this, but, you know, what are your main takeaway messages that, like, if you were facing or, you know, there was another pandemic staring us down, which heaven forbid that happen again in our lifetimes, but if it does, what lessons will you take from this pandemic?
I suggest you go in reverse order because I got nothing.
Well, I can start. Lessons learned is just the continued need for communication, and we did a lot of it. Another lesson learned is prior to the pandemic, I think we didn't have strong support for change. If we wanted to change something in the organization, we needed it to look perfect. And with this pandemic, we said a lot, let's just give it a try, and if it doesn't work, we'll change it. And there is, from our hotline to virtual visits to curbside testing, we're on version 42 for the algorithm that our hotline continues to use today. And I think that has been very helpful to our teams in our organization to know that, it is okay just to try something. If it's not perfect, we'll go back, we'll change it. So we don't have that, we're not scared of change anymore because we have experienced a lot of it. So those are my 2 pieces of advice.
I think from a lessons learned standpoint, it's the old for us to never forget the importance of the entire team. We in healthcare a lot, we look and it's always nurses and doctors, and they are incredible members of our team. But when you look at the pandemic and what it required in supply chain management and what it required in housekeeping and housekeepers and dietary, these are typically your lower paid positions, some of your lower paid positions in a healthcare system, and they were absolutely the lifeline that was keeping us going. And so from that standpoint, no team member is more important than the next, and I think we need to continue to recognize that entire team for the incredible work that goes in every day.
Before we go on, I'm going to ask you a question, Matt. Do you think that all of your employees kind of learned an appreciation for other employees and the job that they do through all of this? Did that become more apparent?
Yeah, and I wouldn't say that they didn't, because we're a small town, and so everybody is pretty, knows everybody pretty well. But it was when you've got physicians on the radio making a point of thanking housekeeping and talking about the importance of the work of that group, and thanking supply chain people, because our supply chain team, they are absolute rock stars. Mike, my supply chain manager, he was on top of things immediately. Every day at Incident Command had reports for us on what was an issue and what wasn't an issue and what we could get from somewhere else. And I think, it's just, we're fortunate to be in a small town that everybody already kind of looked after and took care of each other. But as a healthcare system, this was a very in-your-face reminder of the importance of everybody.
Thanks. How about others? Lessons learned?
I think oh, go ahead.
Go ahead, Renae.
I was just going to tag on to Heather, what she had mentioned about communication. I think for us, we were trying to adhere to CDC recommendations and guidelines. And then we also had recommendations coming from the North Dakota Department of Health. And then the governor's office would do their press conferences and their different types of releases. And it was really difficult to try to maintain the most recent up-to-date communication to be able to respond to the public with their inquiries. I think that, of course, when it comes to crisis, communication is always something to work on, but I think that was extremely challenging this past year. But we really came together as local public health, and also with the physician advisory group, and having physicians there to talk through some of their experiences and challenges helped us all get through that. And us meeting, twice a week as local public health departments, talking through our challenges really made a difference in what we were experiencing, because we were all experiencing different things at different times. I think the eastern part of the state saw their first outbreak first, and then in May, at the end of May, and then we saw ours in July, and we kind of went through different things in different part of the pandemic, and all had to work through the same lines of communication at some point while meeting the needs in our specific communities. So communication, I think, was the biggest lesson learned, that hopefully we can make some improvements next time around.
I would certainly dovetail on that. The difficulty is, you don't always have the locus of control. And, I think part of the challenge is figuring out what control you do have and how to maximize that. And then the communication, the transparency, I think, it harkens back to, our struggling with the floods and, watching Denny Wallaker and how, he essentially said, this is what we know, this is what we're going to do. And it was very transparent, and other people came in and tried to pressure, and he said, no, this is what we've got. But they were very adept at communicating with the public, telling them what they knew, what they didn't know, what might change. I think part of the difficulty was, obviously all the mixed messages that were occurring, as Renae mentioned, not only locally, regionally, nationally. And so I think if you can be as transparent as you can and as frequently as you can messaging, I think that's very useful. But clearly when people say this is exactly what it is, and 2 hours later it changes, the public's faith, wanes. So.
Probably a couple things, I guess we had learned, or I had learned, and one was, I think, Matt's point to rounding. There was some time, if you didn't have a role in patient care, I was feeling, everybody was pretty puckered up. It's like, stay in your lane, stay in your office. And then it got to be a point where they were pretty happy to see you when you did come out. You did it appropriately, you did it quickly, but you did make your round. So that was a lesson learned. And then to kind of dovetail a little bit of what Andy said about communication and the message changing, we actually prefaced a lot of our communication by saying, we realize things are going to change quickly. Here's the current guidance. So they don't feel like you're talking out of both sides of your mouth, is that we're following the guide. We always prefaced our message with, and that took us a little bit. This is the guidance we're receiving currently. This may change tomorrow, it may change next week, and likely will. So that was something we learned, maybe not right away, but somewhere through the process.
And Pete, I'm thinking the other lesson you learned was not to try and plan a trip to Hawaii in the midst of a pandemic, right? Renae, there's a question for you specifically, when you were talking about all the lines of communication. So how did you keep track of all the different communication streams?
I guess we had a department operations center in our department specifically for public health that we worked together really closely and distributed information out to our staff through the department operations center. I think we also had a city's EOC because at some point it became too much for us to try to manage with the department. So our city opened an emergency operations center and they started to take on some of that information. It was challenging, however, with the multiple sources and us trying to filter that out to what message would be going out to the public. We really relied on the Department of Health to provide us with guidance, just because the CDC made an announcement that was a national change, but that didn't mean that was going to be a change for us in North Dakota until we heard from the Department of Health. And so we followed their lead to try to get that consistent messaging out from the Department of Health. And then I think that was a challenge because people of course were seeing national news, they were seeing local news, they were getting all sorts of different reports from everywhere, where recommendations maybe were different. Some states had mask mandates, some did not. Some had different rules for spacing and large events. And they would see on TV, we're not supposed to have large events. And they would call and say, the event center has a carnival. Why aren't you guys doing something about it? Well, we have guidelines, but they're not requirements at this point. And so I think that was another challenge for us was we're supposed to be regulators and we do regulate in certain areas when it comes to environmental health and inspections and following, protocols for illness and all of that. But when we're talking about guidelines versus requirements, we can tell people what the right thing is to do. But if it's not required, we're relying on that individual to do the right thing. That was a really huge challenge, I think, for adherence for us to try to manage, because we're giving this message, this is what you're supposed to be doing. Well, is it required? No, it's recommended. So people would carry on with behavior or the event or any type of situation. And that was really something that was hard to manage from the very beginning all the way throughout the pandemic.
So Debbie Swanson added, we established a joint information center that included the large institutional partners, PIOs, and it helped for consistent messaging, but this was still challenging due to volume of information. So one other question I wanted to ask, and this may be maybe a little heavily charged, and if you're not comfortable asking or answering it, that you don't have to, but Pete had alluded to that there were so many things have been so many things about this pandemic that are very politically charged. And I'm wondering, as healthcare professionals, how have you been able to circumvent the politics or work around the politics that are so heavily layered into this pandemic?
It's been a soapbox issue for me since the beginning. It's political, and you can point the finger at both parties. They've both politicized this. But what we have done is stay out of the fray, follow the science, follow the guidance, and if you have to, quote, blame the government for telling us what to do, but whatever, you have a consistent message. We are following the science. I think it was Matt said, some people getting their information from Facebook and Google, sorry, we're just not going there. We're going to follow the science. So we've stayed out of the fray of the political, and we didn't get on either side of it. That's the best thing we could have done, I think.
There are times where I wanted to scream, but I learned that wasn't very helpful. I think utilizing my colleagues to talk about our frustrations, I think was beneficial. I think, again, if you can find common ground, if you go back, in a root cause analysis, most people want the same things. How to achieve it is really the challenge. And so I think as you can go back and start from there, that most of us want very similar things. We interpret that differently as we expand, and then we just start shouting at each other. So I think, if you can find the common ground and then work from there, I think that's most important. So.
I think it was really challenging for me as a government employee. There's obviously some political tones when you're talking about the work that we're doing and who my oversight is, which is the City Commission. But when we're working through our public health mitigation measures, we really, as you said, have to rely on the science and stick to that. This is what our studies are saying. This is what the science shows. I think I did, throughout all of this, there have been friendships that have been lost because people have really strong political views, and it became to be too much for me to be able to take that on in addition to my job. And it was political, even though the pandemic to me wasn't political. We were doing it on the basis of public health response, and we knew what was right and the efforts that we had to do. But several individuals don't understand that, and really became a contentious issue. So that for me was one unfortunate thing that I would have never expected, that my job working in public health would impact relationships with family and friends and community members in that way.
I see other heads nodding with that too, Renae. So it sounds like you're not alone, unfortunately.
Yeah, that's spot on. Where politics is always it is what it is, but for some reason this specific event just amplified politics and the ugliness of it. Personally, I got to the point I actually deactivated my own Facebook page for about 4 months because it wasn't worth my time and increased blood pressure for a couple hours a day to go online and see the things being said about my staff and healthcare in general. It was so unfortunate that if there ever was a good time to have a pandemic during an election year, it was not the time for it to happen. There's never a good time for a pandemic. Let me just clarify that. But you know, it was extremely unfortunate that it came down to, you know, this state is bad because they're red, or this state's bad because they're blue, and we looked for a reason to politicize anything. Data can always be construed in any which way you want it to, regardless of which side you were on. And you know, unfortunately, our society likes chaos, and we had individuals who were willing to stoke the chaos fire. And that's not just at the federal government level. That's social media. That's, you know, local. I mean, it's just across the board. It was a very, very big issue.
And I would just add to, and we talked about this previously, those personal conversations with the physicians too, especially as we were rolling out the vaccine. We always deferred to the science and the guidelines from our Department of Health, both Minnesota and North Dakota, along with the CDC, but also our physicians took a stance and provided education referring to those guidelines and the science often. And we see that now that we're starting to vaccinate in our clinics, those community members that may have been leery before are having some good conversations with those physicians and altering their opinions too. But we, like Pete, we're trying to keep out of the politicalness of the pandemic and just trying to do the right thing, what's best for our patients and what's best for our community.
I'm sure that was no easy task for any of you to try and navigate. What we have, we still have about 10 minutes. If we have any questions from our audience, this is your chance. Oh, thanks, Pete. All right. Well, I'm not hearing anything, and I don't want to keep people if we don't have anything extra, but I just want to thank our panelists. I think this was an incredible session. I have learned so much from all of you, as well as just gained such a deep appreciation for the work that you have done, the challenges that you have faced, and as not just you, but all of the people that are here in our virtual room. Everybody has been touched by this pandemic and has had a role in our audience. And so I just want to thank everyone for the role that you have played and all of the challenges that you have faced, both professionally as well as personally. And, you know, Renae, you just touched on the personal side of it, but I'm sure that we could probably have a whole other panel talking about the personal costs of dealing with this pandemic. So thank you all so much for your time.